You might think facelifts are just for celebrities and women, but more and more men are choosing to be tucked and tightened around the eyes and chin.
Why? Well, that's what we're about to find out as medical reporter Barbara West begins her series, Facelifts, not for women only. Barb?
But men as well as women want to look as good as they can, as long as they can. And they're going to the plastic surgeon for help. Some of these men are well known. But don't be surprised if the guy sitting 2 desks away from you comes back to work one day looking as if he'd found the fountain of youth. Today, Michael Jackson has a perfectly sculpted nose and cleft chin. Years ago, he didn't. Michael's never admitted it, but the only way to get from looking like this to looking like this is through the surgeon's scalpel. For years, plastic surgery was reserved for the select few, the very rich and famous, usually women. But the demand for cosmetic surgery is growing fast, up 24% during the last 2 years. And it's not reserved for superstars or aging women anymore. Nationwide, 12% of plastic surgery patients are men. Dr. Thomas Trevisani says his percentage of male patients is even higher.
About 20% are men, and that includes facelifts, eyelids, rhinoplasty or nose surgery. Sometimes men will have breast surgery for reduction reasons.
Some men think it's a way to compete against the young Turks of the business world.
I would consider it definitely, yeah.
What?
Well, like in my case, I have a little under the eyes.
Of course, I think so. Professional appearance, you know, very important these days. Anything you can do to get ahead, I think you ought to do it.
But this businessman said he did it for himself and no one else.
But it just makes you feel good, makes you feel good. Nobody wants to grow old, okay with it.
It takes a special courage for a man to face the plastic surgeon's scalpel, and some of them need a little help.
More and more men are coming in either alone or with a spouse or with a second spouse or with a girlfriend.
But it's not just the surgery men worry about. It's the fear of ridicule when they return to work. What do you think your colleagues will say?
That is not, how shall I say, pronounceable at this time.
What are you going to say to them?
Eat your heart out.
That's just what Jim McKinney does say whenever someone sees him for the first time after his facelift.
They think I lost a lot of weight in Hollywood. They can't quite figure what happened to me. I mean, you know, they just stare at me. I'm glad I did it.
Having a facelift is major surgery. Tomorrow we'll take you right into the operating room so you can see how it's done yourself. Our patient, a 60-year-old man, is changing his looks and his life.
You know, I would always be afraid you wouldn't have a natural look, kind of stare eyes or something, but those gentlemen really looked great.
They look terrific.
Not everyone likes what they see in the mirror after a few years, men included.
And many men are facing up to that with the courage to do something that only women would brave at one time. That story's next on Eyewitness News. Perhaps you've heard the old saying, vanity, thy name is woman. Well, that's not necessarily true today.
Nope, more and more men want to recapture their youthful looks by going to the plastic surgeon. Is it for you? Well, watch closely as Barbara West brings us part 2 of her series, Facelifts, not for women only. Barb?
But having a facelift is not at all like going to the spa for a facial. It's major surgery, and for men it can be a little more difficult than for women, but the results can be fantastic. Tonight I'll show you how it's done.
Your coffee?
Yeah.
At age 60, Henry Apetz is turning his life around. He's moving, getting married, and having a facelift.
We're moving forward. We're going to leave all the old behind and start afresh.
Like many other men, Henry first thought of having a facelift when his fiancée had hers. But it was really the bagginess over his eyes that bothered him most.
Finding out that I have lost about 30% of my peripheral vision because of these skin flaps on the eyes.
Henry hopes the surgery will help him show the outside world how he feels inside.
I feel like I'm still a teenager. I can do anything I want within limits. And I look like an old man that shouldn't be doing these things.
On the day of the surgery, Dr. Thomas Trevisani marks Henry's face, finding the expression lines where he'll hide the scars. The operation to wipe away the years from Henry's face will take 4 hours and will cost $6,000.
I try to get an idea from the patient what they really, really want, what's in their mind, or in their mind's eye. What do they see themselves trying to be afterward?
First, the doctor removes extra skin and fat pockets from Henry's eyelids. A few stitches, and the bulging skin flaps disappear. Next, Dr. Trevisani makes an incision in Henry's scalp, starting above the ear, working his way down in front, and ending behind the ear. Meticulously, he loosens the skin from Henry's face. Then he suctions out excess fat.
A man has a very thick, roughened, textured skin. Consequently, the technical execution of the operation is much more difficult, and the potential for complication is a little higher.
Dr. Trevisani pulls Henry's face tight to the ear. He removes the sagging skin and stitches the new face into place. A half hour after surgery, Henry's already talking, but not much. How do you feel now?
Groggy.
You feel groggy? Huh?
Yes,
Does your skin feel tight at all?
very tight.
Believe me, Henry looks much better today than he did right after his surgery. Tomorrow you'll get to meet the new Henry and hear what he thinks about his new image. Yesterday we left Henry Apetz looking much like a bruised beach ball. Rest assured, today he looks much better.
Yeah.
This photo is the old Henry Apetz, before plastic surgery peeled years away from his face. Just 2 weeks later, as stitches are removed, the new Henry emerges, still swollen and a little bruised. Like other men, Henry shuns makeup, but a little dab here and there will help cover bruises when he returns to work. Was it worth it? Well, Henry's not too sure what he thinks of his brand new face.
It has taken me 60 years to get to where I was, and now 2 weeks later, hey, I'm a different person, at least as far as looks are concerned. And it's going to take some getting used to.
Paramedical makeup consultant Jennifer Lepack works with a lot of plastic surgery patients. She says that reaction is normal, especially for men.
People have different expectations of what a facelift is supposed to do. Sometimes it takes 3 months down the road for you to fully realize how great it looks.
Even after the swelling's gone, men face problems that women don't.
The potential for complication is a little higher, particularly with bleeding. Plus preservation of the hairline, the fact that he may post-operatively have to shave behind the ear where he never had to do that before.
Although it's rare, any facelift patient, man or woman, can have an ongoing problem of facial numbness. The secret to any facelift is finding the right plastic surgeon. Not every doctor doing facelifts is qualified. For example, any doctor can call himself a cosmetic surgeon.
Who the patient goes to should begin with that process, the selection of board-certified plastic surgeon.
A doctor certified by the American Society of Plastic and Reconstructive Surgeons has completed an approved 3-year residency in general surgery, 2 to 3 years additional training in plastic surgery, and has passed written and oral exams.
Beyond that, it's a matter of personality, really, who the patient feels most comfortable with. Now, it's up to the doctor, too, to be honest with the individual and be forthright with what he can do and what he cannot do. We can't work miracles.
Now, a month after his surgery, Henry is starting to enjoy his new image. He's even taking dancing lessons.
I don't want to sit and grow old on a rocking chair. I want to do things yet.
About 6 months for Henry to completely heal. A facelift is a very personal experience, and I want to thank Henry for being candid and sharing it with all of us.
That was pretty terrific, and he is looking much better
Oh, yes,
day by day. Thanks, Barb.